You can back up a little bit. So this is just the way I cath. I keep a Band-Aid over the stoma. And really the prep is the important part. Wet ones, antibacterial wipe. So what they did for me was, real quick, they took my whole bladder out. Obviously they cut you open right there. And they built a new one out of intestine. And I'm sure it's bigger than the old one. But I'm glad it's gone totally, because there's no more bladder spasms. And they told me for people who just have it augmented, they slice it in half and make it bigger with intestine. And they tell me that it doesn't spasm after that at all either, because something about cutting it in half does it. So basically I'm just sanitizing these 3 fingers, because that's what I'm touch the cath with. A friend of mine uses those pre-lube casts. They're just too much trouble for me to grab. So I have a straight cath, and it's not lubed at all. I'm gonna lube it. I'll show you. The prep's the important part. So I wipe off around the stoma. And then I'll wipe where the Band-Aid touches it. Fold it. Try to stick it right there. Okay. Another important part. Iodine swab. And I started out using 1 swab every time, then I figured out I could, and I put it on the Band-Aid too. I figured out I could get like 3 or 4 uses out of it. Like so, about halfway. I keep this all sterile because I'm going to grab it in the middle. One little globule. So I grab it with 2 fingers right there. And I'll get some on either side of the tip. This part I keep sterile. And I touch it where I wipe my fingers down. Kind of get it going in. And then I'm gonna get my bottle. When I travel, I just get a bottle that has about 28 ounces. And then just slowly, there'll be some resistance because there's a valve down there. Just give it kind of constant pressure. You don't want to go too hard ever. Obviously you can't feel any of that because there's no nerves. Just constant pressure until it goes through. And then I'll push it a little further. I just keep pushing it real slow until right there, it stops. You can just feel it where it won't go anymore. And then I watch the flow, because the flow will stop as it drains, and then I'll let a little bit out as it fills it up. They used to make a 32-ounce bottle, but then they quit on me. So sometimes it gets to the top, and I either have to get a spillover bottle. So I use a 16 French because Coloplast, because there's mucus because it's intestine, and so the 16 French Coloplast, the holes are big enough to drain the mucus. Otherwise, you're supposed to. I'll just back it out, push it in a little just to get it. When you back it out and it stops, that's it. So when I'm at home, I'll have a tray, like a barred tray, and I'll just drain into that. So I'll just put the tubes in the bottle when I'm done, and wipe that off like so. And then one more time with the iodine. Before I started putting the iodine, I would get like an infection a year. So it's just a little extra precaution. And that's about it. Dump it and go. All right. Cathing.